Ayahuasca, a potent plant-based brew traditionally used in Amazonian spiritual ceremonies, has gained attention in recent years as a potential treatment for addiction. Enthusiasts claim it can help people confront emotional trauma, gain new insight into their behaviors, and catalyze a personal transformation. But while the idea of a single, intense psychedelic experience leading to recovery may be compelling, there are many reasons to approach ayahuasca with caution, especially when dealing with a condition as complex and deeply rooted as addiction. Despite anecdotal reports of emotional breakthroughs and spiritual healing, the scientific evidence supporting ayahuasca as a reliable treatment for substance use disorder remains limited and preliminary. Most existing studies are small, lack rigorous controls, and rely heavily on self-reported outcomes. They often involve highly motivated participants in supportive ceremonial contexts that are difficult to replicate clinically. Without larger, long-term trials, it's impossible to determine how much of the reported benefit comes from the drug itself versus the surrounding psychological, cultural, and environmental factors. These uncertainties make it dangerous to promote ayahuasca as a legitimate alternative to established addiction treatments, such as behavioral therapy, support groups, and medically supervised detox. One of the greatest risks with ayahuasca lies in the intense and unpredictable psychological effects it produces. The brew's psychoactive compound, DMT, interacts strongly with serotonin receptors in the brain, causing powerful hallucinations and deep emotional experiences that can last for hours. While some describe these experiences as transformative, others endure overwhelming fear, confusion, or psychological distress. For individuals with underlying mental health conditions, particularly mood disorders, schizophrenia, or bipolar disorder, ayahuasca may exacerbate symptoms or even trigger a psychotic episode. These risks are not theoretical. There are documented cases of people experiencing lasting psychological harm following unsupervised or poorly facilitated ceremonies. Physical side effects are another serious concern. Vomiting, diarrhea, and increased heart rate are commonly reported, but these are often misleadingly framed as part of a spiritual purge. In reality, these reactions are the body's response to a highly potent and potentially toxic substance. More serious complications, such as hypertensive crises, seizures, or serotonin syndrome, can occur, especially when ayahuasca is combined with prescription medications like SSRIs or MAOIs. These drug interactions can be fatal, and many people are unaware of how dangerous the combination can be. In addition to health risks, ayahuasca poses legal and ethical problems. The substance is illegal in many countries, including the United States, except for narrowly defined religious use. Those seeking treatment may travel to countries like Peru or Brazil, where ayahuasca is legal in certain contexts, but doing so introduces a host of new dangers. The lack of regulation and oversight in some retreat centers has led to reports of physical abuse, psychological manipulation, and even sexual assault. The ceremonial setting, while culturally rich, can become a vulnerable environment when safety protocols and professional standards are not maintained. The romanticization of ayahuasca tourism overlooks the exploitative practices and psychological risks that often accompany such unregulated experiences. Furthermore, viewing ayahuasca as a shortcut to recovery misunderstands the nature of addiction. Substance use disorders develop over time and are reinforced by a web of psychological, biological, and social factors. A single visionary experience, no matter how intense, is unlikely to resolve the deeply ingrained habits, emotional triggers, and structural challenges that drive addiction. While it's true that some people report insight or emotional relief after taking ayahuasca, that does not equate to lasting change. Without sustained support, therapy, and lifestyle adjustments, the initial emotional catharsis may fade, leaving the individual vulnerable to relapse, or worse, disillusioned and feeling hopeless after a highly anticipated experience fails to deliver lasting results. There is also a danger in the cultural narrative surrounding ayahuasca, which often positions it as a sacred cure-all removed from scientific scrutiny. This framing not only creates unrealistic expectations, but also risks turning vulnerable individuals away from evidence-based treatment. Addiction requires a nuanced, long-term approach that respects both the biological underpinnings of the disease and the psychological resilience needed for recovery. Suggesting that a psychedelic experience can resolve these challenges can be misleading and, in some cases, dangerously irresponsible. In the current landscape, the safest and most effective treatments for addiction remain those grounded in clinical research, including cognitive behavioral therapy, motivational interviewing, and medication-assisted treatment. Psychedelic therapy is an exciting area of research, but it is still experimental and should not be considered a substitute for methods with established track records of safety and efficacy. Until far more is known about ayahuasca's long-term impact, dosage regulation, patient screening, and appropriate integration into medical care, its use should be viewed not as a solution, but as an unproven, high-risk intervention. Ultimately, while ayahuasca may offer some intriguing insights into the mind and emotions, it is not a reliable or universally safe treatment for addiction. The risks, physical, psychological, legal, and ethical, are real and often downplayed in popular accounts. People struggling with addiction deserve thoughtful, evidence-based care that prioritizes safety, structure, and long-term healing. Until the research catches up with the hype, ayahuasca should be approached with skepticism, not as a miracle cure, but as a powerful and unpredictable substance that demands caution, context, and critical thinking.